The recent overturn of Roe v. Wade had had a tremendous impact on abortion laws and is now affecting the women's health care throughout the country. Each state determines if abortion is appropriate for a specific gestational age. If pregnancy was caused by incest or even rape, abortion may be permitted. If the pregnancy threatens the mother's life, it may be allowed. According to CNN, nearly 24 U.S. states have banned or limited access to the procedure. States where abortion is the most limited report higher rates of maternal and infant mortality, as well as greater economic security. States that have restricted access to abortion services had maternal death rates in 2020 that were 62% higher than in states preserving access to abortion services. Most would argue that this dire issue needs to be left up to the particular individual and their healthcare provider. However, most medical professionals are worried if they should provide medical advice about this matter to their patients. Women are suffering by the hundreds of thousands. According to the Joint Economic Committee 2024, over 171,000 women traveled away from their restrictive states to seek abortions in 2023. And nationally, women are traveling 3 times longer than they were for care before the Dobbs decision. Some women become desperate and are willing to subject themselves into harm's way. According to Oberman and Lehman 2023, where abortion is illegal or highly restricted, women resort to unsafe means to end unwanted pregnancies, including self-inflicted abdominal and bodily trauma, ingesting of dangerous chemicals, self-medication with a variety of drugs, and reliance of unqualified abortion providers. The bioethical principle that is being violated is non-maleficence. Healthcare professionals in states where abortion is banned are caught in a hard place. Women are seeking advice from their healthcare providers about where to receive an abortion, yet it's considered illegal for these professionals to do so. They are worried about losing their license as a professional for assisting patients with life-saving information. The event is important to me as a professional because it will affect how I treat and serve my patients in the emergency department, and it also affects my future patients as a nurse practitioner. According to Orman Lehman, the chilling effect of abortion bans threatens not only patients' well-being but also providers' well-being, and by undermining the doctor-patient relationship, the law erodes the integrity of the medical professional as a whole. The Nursing Code of Ethics is very relevant to this issue and is also being violated. According to American Medical Association, AMA issued a state decrying the decision as a derogative allowance of government intrusion into the medical examination room, a direct attack on the practice of medicine and the patient-physician relationships, and the brazen violation of patients' rights to evidence-based reproductive health services. The implications for these issues are very confusing and almost regressive. It's not right for professionals to turn a blind eye or allow these issues to continue. AMA Code of Ethics, which states when physicians believe a law violates ethical values or is unjust, ethical responsibilities should supersede legal duties. We are living in such uncertain and divided times. It is unfortunate this is happening in our own, to our very own women, and it yet is very preventable. There are issues that I believe that are left to the healthcare professionals and specialists.